Good morning.
Fezile, what is the cause of the high pregnancy rate in KwaZulu-Natal?
In KwaZulu-Natal, I would say a study was conducted because of the high rate of pregnancy in the province. And that study, amongst other things, revealed that the issue of exposure of these teenagers to sex at early stages, where you find that on average most of them start practicing sex at the age of 16. But we do find cases where also, at the age of 10, you find that children are already sexually active. Also, the issue of culture was among, the determinants that were found by this study, where you find that there are cultural practices in the province which, in a way, do, promote or encourage teenage pregnancy. Also, psychosocial issues, where you find that peer pressure is another issue, where you find that they get into practicing sex because, of the pressure that they get from their peers, and the fact that, some of them, they want to experiment. Issue of economic factors that are related to economic, where you find that poverty, that as a province, we are the province with the highest level of poverty. So you find that, these teenagers, because of the poverty rates in the province, they do, find themselves, having affairs with what we call sugar daddies, who will be able to supply them, with food in other cases. Sometimes they are looking for things like cell phones, clothes. Also, the issue of a household, where we find that, there are no longer healthy parent-child relationships in our families in the province, where parents do not discuss sexual issues with their children, and where you find that also the parents, of these teenagers are young themselves, and they have no experience in terms of parenting. So those were, among others, the determinants that were found by the study that was conducted in the province in 2011.
What is the biggest contributing factor of all these factors that you've mentioned?
I would say we can say poverty is the biggest one, because, we are in the province, as I said earlier on, with the highest rate of poverty. A rate of unemployment in the province is on its highest. So when these families and these teenagers can't provide for themselves, they look at other options, which will assist them in terms of, getting, money to buy food, getting money to buy nice things. But also in the province, we have also found that issue of substance abuse is another contributing factor to the issue of substance abuse, of teenage pregnancy.
Now, what are the cases that you have dealt with on the ground with regards to these unemployed teens who are single mothers, or parents for that matter?
As a department, we're dealing with a lot of teen mothers who are unemployed, and as a department, we have programs that look at empowering them in terms of helping them to form co-ops, which we fund as a department, where they start their own small businesses so that they are able to generate income. Also, we have youth academies in the province, where they are empowered with skills that are going to help them to go and look for the jobs. We also have programs called Sustainable Livelihoods that looks more at the issue of food security. As I said earlier on, that if there's no food in the family, these teenagers, they find themselves tempted to go and get involved with sugar daddies who can provide them with money to buy food. So these food security programs, they assist these young mothers. We also have bursary schemes which targets these young mothers in terms of the opportunities that we have. We have scholarship on social work and other scholarship. Also the learnerships in terms of EPWP, they also assist these young mothers who are unemployed. We have program called Integrated Community Caregiver Program, where we recruit them and pay them a stipend, and they assist in terms of working in their communities and bringing or raising awareness to the other teenagers in their areas. Also, we have early childhood development, because obviously once the child is there, we also need to take care of these children, where we put them in our ECD centers. We are looking there at the important 1,000 days of life for the child. Also in these centers, they are provided with nutritious meals, and they also get stimulation programs. Also, we focus on parenting programs. As I said, that these are teenagers themselves. They have no experience of parenting whatsoever. So our parenting programs, they focus on empowering in terms of how to take care of this child that, you know, they have bring to life. But we also focus on fathers on this program, because we want to encourage co-parenting.
Now, is there a sense maybe from your department that the social grant could be maybe a motivation for young women who opt for pregnancy over education?
There was a study that was conducted by the Department of Social Development, which was commissioned at national level in 2008. This study indicated clearly that there's no link, there's no scientific link between social grants and teenage pregnancy.
And so says the KwaZulu-Natal Province SA Director of HIV-AIDS in KwaZulu-Natal, Fezile Luthuli, from our Durban studios. Thank you so much for joining us.
Thank you very much.